Greetings, this is Kareem Salib. I'm a third-year cardiology fellow at Ascension St. John Hospital in Detroit, Michigan. I'm going to be presenting a couple of cases today to discuss aortic surface mobile components on 2D and 3D TEE, and I have no relevant financial disclosures. So arterial surfaces generally appear static on ultrasound, with exception for gross mobile thrombi and atheromas and dissecting intimal flaps in the aorta and carotid artery. Closer inspection reveals subtle findings of the surface mobility of the arterial surface, such as minute high-frequency motion and fine mobile strands. We previously described mobile carotid strands at the common carotid artery bulb junction on 2D imaging using 10 MHz linear transducers. This experience has prompted us to determine whether arterial strands occur elsewhere. Here we report 2D and 3D findings of strand-like structures on the aortic intimal surface on TEE echo of two elderly patients with aortic stenosis. The TEE probe that was used was the Philips X82T, and it was included in a routine evaluation of the descending aorta in biplane and 3D imaging. So moving on to our imaging findings, our first case was an 88-year-old female with history of coronary artery disease and hypertension and severe aortic stenosis that was undergoing the TEE evaluation of her aortic valve. The TEE was done using the 8 MHz X82T probe, and it showed severe calcific aortic stenosis, moderate LVH, and a normal ventricular function. On imaging of the proximal descending aorta, the far wall was imaged 3 to 3.5 centimeters from the transducer. 2D images showed a 2 millimeter long filament attached to the thickened intimal wall of the proximal descending aorta that had focal areas of thickening, and those are marked by the colored arrows. These findings on 3D imaging had a delicate planar appearance. The underlying intimal medial complex showed normal thickness. Moderate heterogeneous atherosclerosis was present at other sites as well. For our second case, this was an 84-year-old female with past admissions for multiple TIAs and congestive heart failure that was also undergoing a TEE to evaluate for severe aortic stenosis. Intraoperative TEE did show critical aortic stenosis with severe calcification and mild LVH with normal ventricular ejection fraction. The proximal descending aorta far wall was imaged 3 to 3.3 centimeters from the transducer. 2D imaging revealed moderate descending aortic atheroma with areas of calcification. The intimal medial complex was thickened and also showed areas where the echogenic intima was absent. Multiple mobile filaments were present as well, and those are also marked by the colored arrows. Some very fine, up to 13 millimeters long, or appeared attached on the subintimal layer or adjacent calcific plaque. And those are also displayed on the images and the videos on the screen. The strands we describe on the surface of the aorta resemble very closely the strands we previously described on the surface of the carotid artery by ultrasound. Although the histological correlation is not known, the differential does include a detached intima versus fibrinous strands. In the first patient, the detached intima is suspected because the continuity of the strands with the intimal layer and the lace-like planar appearance on 3D imaging. In the second patient, the strand-like structures appeared in association with the subintima, where the echogenic intimal surface was absent and the adjacent atheroma. The strands here are much finer than the first case, suggesting fibrinous etiology. Also, in our cases, the addition of 3D imaging revealed planar or web-like characteristics of the structures that appear strand-like on 2D, which is a unique finding that was not previously described. We show that TEE can detect fine surface mobile components on the surface of the aortic wall, that strands on 2D imaging can have a 3D planar appearance, and with more continued technological advancements in the resolution of TEE probes, these advancements can shed additional light on the pathophysiological mechanisms of this finding. Thank you.